Well, that's our corporate structure. 11 independent companies, separately incorporated, operating hopefully synergistically. But realistically, if you looked at that and you didn't know what it was all about, you'd think, well, who's the fool that designed that? I mean, that's really complicated. Do we really need something like that? Well, honestly, we didn't set out to design that. Okay? What we set out to design was a medical home across the entire continuum of care. So it wouldn't matter if a child needed primary care services or needed a consultation from a specialist or needed a home health visit prior to prevent coming into the hospital, or hospitalization, or home health as they leave the hospital to help them recoup better at home. So that's what we ended up creating. But when we were done, we sort of said, well, we could keep tweaking this for the rest of our careers collectively. What do we really want to do with it? So in 2005, about 15 physicians and 15 administrators went off site for 3 days to figure that out with the inevitable help of our very helpful consultants who did a data dump on us. The good news is by mid-morning of the first day, I think we had all reached consensus about what we wanted to do. And that was basically, in addition to providing the best medical care we knew how to provide for children, to figure out if we could work in the community and find ways to keep children from having to access hospital-based services and actually begin to improve the health of the overall community. So with that in mind, we created the Promise, which was sort of a distilled version of an 80-page strategic plan. Of course, I'm the strategic planning guy, and I am a self-confessed recovering MBA. So I loved our 80-page strategic plan. It was great. It had overarching meta strategies and guiding principles, and it was really cool. The problem is nobody understood it, including me. So this works a lot better. But it does pose a problem because with my strategic planning hat, when we say we're going to improve the health of every child in the region, well, what does that mean? What does that look like? We've got a lot of information about child morbidity and mortality, but you start looking for information about child health and wellness and how you measure that and what does that mean, and there's just not that much information out there. And the information that's available is generally at a national level, which isn't granular enough for us to really act on locally with our kids. So we got real cocky and created a survey we call CHAPS and distributed that, got the data back, crunched it, went to our board of trustees, and bless their hearts, they sat there and listened to me spew data for half a day, and they all stayed awake. And then after lunch, they came back and rolled up their sleeves and said, these are the 7 things that we think Cook Children's Healthcare System can work on that will have a positive effect on the health of children in our community. And you can see there's no real surprises up there. Asthma's number 1, followed by weight issues, dental, mental, safety from injury, safety from child abuse, and access to care. So those are the 7 issues that form the basis for what we call Healthy Children 2020. So to do that, there's basically a 2-pronged strategy. I've mentioned one already: continue to develop the hospital-based services that improve children's health and medical care. Another is to expand our community health outreach. And then at the end of the board retreat, an interesting thing happened to me, at least. About 1/3 of our board members came up individually after the retreat and said, we want to be clear, this isn't a one-time thing. We want to build something that's sustainable and goes on into the future. So those 2 strategies were to be done through a sustainable infrastructure. And from that infrastructure came the Center for Children's Health. And we are dedicated to continuing to work with the survey, work in the community research, community health outreach, and the idea is to create collaborations that align organizations across North Texas to make this the healthiest place for children in the U.S. So pretty lofty goal, but pretty simple and pretty straightforward. Like anything else, the devil's in the details. So let's talk about some early successes and some progress that we've made toward fulfilling that promise. First of all, there's the organizational structure. Dr. Gonzalez is our medical director. Jenny Hickman is in charge of community health outreach. Dr. Jackie Meeks is our community research director. Just added Diane Daly. Dr. Diane Daly is our executive director for our Center for the Prevention of Child Maltreatment. And we have a great team working together on this problem. So CHAPS, Community-Wide Children's Health Assessment and Planning Survey. We did that in 2008, got responses back from 7,400 plus parents that shared information about their children, age 0 to 14, about 200 questions, which is pretty daunting for any survey. We repeated it, had the opportunity to do that again in 2012, and that time we got back 8,328 surveys. So this is a robust sample of parent-perceived notions about their children's health. Okay? So just as an example, in asthma, we know comparing the two, lifetime asthma actually declined on a percentage basis between 2008 and 2012. But guess what? The population grew much farther, much faster than the rate of asthma decline, and so the total number of children with asthma actually increased. By the way, for those of you who are not statistically minded, the key is if it's green, it's good, if it's red, it's bad, and if the arrow going up and down is the direction, and if it's got anything except a yellow arrow like that, it's statistically significant. Great, isn't it? Stats 101, you pass. So we also know that boys are great at risk for asthma. That actually declined, and African American children's risk went up. We don't have explanations for this. This is all descriptive data, so it's not causal in nature, so we can't get to that. Right now, we are working on, in fact, I just signed the contract for CHAPS 2012. So we'll add our third data point to understanding how we can profile the health of children. I've offered some handout materials. This just happens to be one that I left for you. It's an overview of the things that are all improved across all 6 counties between 2008 and 2009, and it's all about awareness and perception and access to services. There's tons of data on our website. Please go visit it if you're data inclined. Go visit it anyway, even if you're not. It's a fun place to visit. So what do we do with all of that? 2 surveys, 200 questions, 7,501, almost 8,500 in the second. Well, it's on the website. You can actually access the data directly, and it's accessed on a regular basis. We have a quite robust data user community. But we also have, under Jackie Meeks, master student research. So with that kind of data, we can't possibly plow through it all and do it justice. So we have asked the students from our local universities to come in and help us and give them an opportunity to work on their theses. These are the last 10. A particular note to me is this one. I have a great interest in that one. That was an individual that wanted to look at the science of surveying and figure out who didn't respond to questions that were perceived to be sensitive, and what was the non-response rate, and what were the predictors of non-response. So that has been very helpful as we design our CHAPS 2015 survey. So it actually is working to make it better. Those are actually available for use. The other handout you have, and they're different, they're not all the same, is something that I was never sure was really going to happen, and it has, so I'm proud of it. That is that the data would actually be used for academic and scientific research purposes and be published in journals that had some reputation. Now, these aren't medically peer-reviewed journals. One's an education journal that is peer-reviewed by educators. The other is a science and fitness journal, which is peer-reviewed by science and fitness specialists. But to think that they took our data and were able to make that association and get something published that had some academic merit and of interest to others outside of our community, that's just icing on the cake as far as I'm concerned. So I offer those up to you as well. Regional collaborations, working out in the community. We've always worked in Tarrant County and had a lot of great coalitions and collaborations with our partners. The past 3 years, we have built 5 new children's coalitions in the 5 surrounding counties. They've established their infrastructure. They've selected what they wanted to work on that's passionate to them. Our mantra is in the community, by the community, for the community, but most importantly, by the community. They pick what issue they want to work on. We ask them to limit themselves to one issue and one evidence-informed practice to pilot. All the pilots are underway as of this past fall. We're hurriedly working to gather the information and see how successful those pilots have been. Then we can make the fine-tune adjustments or replicate them or what needs to be done. And those are, in Denton, they focused on mental health. In Parker and Johnson counties, dealing with childhood obesity. In Wise and Hood counties, child abuse prevention. So you can see quite diverse, but not all the issues that we set out to address are addressed in the community, so we still have some gaps we need to fill in. Interestingly, our regional CCPN physicians are located in Denton, Louisville, Flower Mound, Granbury, Burleson, and Willow Park. So hold on to that thought, because I'm going to come back to that in a minute. So what have we done? Fulfilling our promise. Sharon Davis shared medical appointments. We've demonstrated decreased ED visits for asthma and decreased ED visits for any form of primary care in that population. Nancy Danbro and Sharon Davis just recently completed helping us put together a 2014 asthma video. It'll be distributed through all the independent school districts around Tarrant and the surrounding counties. I'm involved with the North Texas Asthma Consortium. I'm the president of that group for this year, and also involved, and this sounds bad, the Health and Wellness Alliance for Children, which is the Center for Children's Health corollary that is at Dallas Children's. Shh, don't say that too loud. But the reality is they've chosen asthma, and truthfully, children with asthma don't understand about geopolitical boundaries. It's asthma, and it's an issue we need to deal with, and we can do it together. And then an odd thing happened this year, odd to me at least. A physician who was here being interviewed to be recruited apparently had gone to the CHAP's website and asked if she could meet me. Now, I've never been part of a recruitment process for a physician in that way before, so it was kind of an odd sensation to say, well, they really want to talk to us about our CHAPS initiative. Erin Newman actually is very intrigued in working in childhood asthma, so delighted to have her on board. Sharon also has a Healthy Living shared medical appointment, still collecting data and working on the results from that. Dr. Wilson has his REACH clinic on cardio risk assessment through hyperlipidemia. And Alejandra de la Torre has just started working with Child Health Association on a weight registry, so we can start collecting a catalog of issues with health, weight, and management. Kim Magnum at Keller Primary Care is working on projects of how do I incorporate healthy lifestyle, wellness, eating habits in my primary care practice. And Diane Arnott and Jenica Rose Stein have been using our 5210 in Parker County as an integral part of what they're working on with their patients. In the community, we've had a bunch of community events in Parker, but most exciting is our partnership with Hill College and Marty Elementary to put in our first community garden at the school. And then one of the coolest things we work on is with a group called Health Teacher and a product that has an odd name called Go Noodle. And Go Noodle is basically desk side activities, are called 5-minute brain breaks, and it's where kids get up and move at desk side and go back to work, or they're also calming exercises. So the advantage to the teachers, they can use these resources to, as the kids are coming in from recess, they need to calm down and focus, they can use the calming exercises. They come in first thing in the morning and they're all kind of, they can do the desk side activities. How widespread is it? 18 ISDs, 356 schools, almost 5,000 teachers, 106,000 students using it. In this school year alone, we logged over 5.5 million minutes of desk side activity that did not occur last school year. And it's all because of what we were able to provide through Cook Children's and the Center for Children's Health through those ISDs. And the coolest thing that I just found out last week, there were 942 kids that went home and created accounts from home. And you're not even supposed to be able to do that using Go Noodle. So now the folks at Go Noodle have put together a home module so they can carry the activities home. So that's awesome. When kids transport what they're learning from the classroom back to the home, that's a home run by any definition. Our dental health, first pediatric dental clinic co-located with our 6th neighborhood clinic, part of our 1115 waiver project. It's also funded by the generous contribution by the Morris Foundation, set to open in mid to late September. Save a Smile, 5,000 oral screens, lots of work going on there that's great. Oral Health Coalition giving out dental hygiene kits. One thing you may not be aware of is in our own neighborhood clinics starting January 20th, every child that comes in for a well child visit gets a dental hygiene kit that's appropriate for his or her age. They also get a new toothbrush if they get a positive strep screen. So we can make a difference in our community by doing things just like that. And so that's all separately funded. For mental health, we've got a new pilot project for implementing trauma-informed care in our homeless population. We have a huge homeless initiative, so we've integrated that. In Denton, our Denton community wanted to gather together their providers, so we helped them create a website that we just launched in May. It's a provider network for use by the providers. So it's basically a no wrong door to the right care, regardless of where a child shows up. The providers can now access each other's information and get access to the right care for those kids. Still not a big enough network, I know that. We need to work on that, but this is a start. New for this year is Adolescents Resiliency, and the Mental Health Connection is the lead organization for that, and we're playing a huge role in that in this community. Safe from Energy, we're just beginning to explore what are the differences between hospital-based safety programming and community programming. There's lots of differences, there's lots of overlap. We need to start figuring out what that looks like and see if we can merge that together. In the community, we help you to have safe kids. We have a new partner with Firestone. They are training their managers to do car safety checks, so we're multiplying that effect pretty dramatically. And just in April, you may have seen the news coverage for April Pools Day, which was a mock drowning event, pointing out how the challenges we have in dealing with children drowning in household pools. Safety from abuse, Jamie Kaufman and her team have always used a period of purple crying. We've taken that and moved it out to Wise County and partnered with Wise Regional so that every mom that leaves Wise Regional gets a period of purple crying training. We've had 6 parent cafes in Hood and Wise County since January 1st. Parent Cafe is a novel approach of non-mandatory parenting skills testing, and it's based on the Nurturing Parent model. The Nurturing Parent model's got 78 some odd modules to it. We picked the 13 or 14 that we think are relevant, and then we invite parents to voluntarily come together, usually in a faith-based organization, and provide child care, and then they have a facilitated discussion. And it's pretty powerful, and it works. Stewards of Children, Mary Kay Powderly put me onto this. We immediately sponsored a project between Cook Children's, the Alliance for Children, and Fort Worth ISD to train every elementary school teacher in the Fort Worth ISD with Stewards of Children. This is a child abuse awareness and response training. It's absolutely excellent. We're about 50% of the way through the elementary school teachers, and about, I guess we're almost at 20 months now. So it's a slow process getting time to get on their schedule and get the training in, but we're persistent. Child maltreatment resources at cookchildrens.org under checkup. And the coolest thing that's happened this year is the funding and startup of the brand new Center for Preventing Child Maltreatment with Diane Daly. We just sent an announcement Monday, in fact, that we're at full staff and we've got our infrastructure built, and now we're getting ready to crank out and get some work done. So pretty exciting times for there. So what do I need from you? Well, first of all, it's pretty clear all of these things are pretty monumental. There's no way that Cook Children's or any other single organization can solve these problems by themselves. And if there ever was a case where it takes a community to do something, these issues really take a community. We created the ecosystem model for children's health after a lot of research that told us there's lots of good work about ecosystems and children's health development, but they're all academic and they're not practical. This gives us a practical tool to talk about who needs to be at the table, who needs to be involved, and primary to that is our medical care community. So, with that, we share a dilemma. In your practices, you have thousands of resources to choose from, and so how, if you choose to promote health in your practice, how do you do it? How do you make that choice? How do you know resources to pull? It's an amazing sea of information. Some of it's even pretty good, but you don't ever know that until you've tried it. I've got a dilemma. What can we do to provide services or tools that can be of the greatest use to achieve the objectives you want to achieve in your practice? I got put onto this when Jose started visiting physicians, and we discovered our folks out in Parker County at Willow Park were using our 5210 materials as just an integral part of their practice. Okay? So is there an opportunity to coordinate health messages, materials between practice and community? I think there is, but I don't know how to do that. So part of what I want to start today is a dialogue. We don't have to finish it today. We're not going to find any answers today. I understand that. But I want to put the question out there and continually continue to call the question over the next few weeks and months of how we do that. Now, I have some boundaries about how we do this. The boundaries for me are we can't add to the physician-patient encounter time. So it's got to be seamless. We're not going to ask you to spend more time with the patients teaching them how to do something. It can't be an added burden on the practice expense and bottom line. So we have to find ways of funding this. Fortunately, through the Center for Children's Health, we do have some funding tools. They're not completely inexhaustible, but we do have some funds available that we can put toward that. And it has to be uniform, same kind of messaging. It actually has to be used. Okay, don't want to just give you something and have it sit idle. And we need to figure out how to measure it. And that can be as simple as saying it's a bookmark for on a particular topic, and I got 1,000 and I handed out 980 of them. I mean, it doesn't have to be complicated. So that's the challenge I have. That's the dilemma we're in, and I think between us we can figure out how to do that. Needless to say, I'm a little pumped about this. Honestly, 6 years ago, if somebody said, what are you going to do as you think about retirement? My answer would have been, I'm going to fly low, sail into the radar screen, and ease on into retirement. Now they're going to have to take me screaming and kicking because I get up every day pumped up about this. Stats guy, got to leave you with one final stat. Kids are 24% of our population. They're 100% of our future.